Today officially marks 4 years since Florida's first COVID-19 cases were confirmed. Since then, so much has happened. Researchers continue to study the virus and how it continues to change.
ABC Action News reporter Larissa Scott live in Tampa this morning looking into where things stand today. Larissa?
Well, James, over the past 4 years, there have been millions of infections, hospitalizations, and deaths worldwide. And now, while federal health officials are still tracking cases closely, they tell us a lot has improved since then. On March 1st, 2020, Florida's first COVID-19 cases were confirmed, both of them in the Tampa Bay area. That day, Governor Ron DeSantis declared the situation a public health emergency. And over the past 4 years, the CDC reports there have been more than 1.1 million deaths related to the virus.
If we look at some of the peaks in the pandemic, the death rate was 25 to 30%, a national death rate for the pandemic.
The latest data from the CDC show the death rate is currently around 2.4%.
And the chances, if you get COVID, of dying from it are much lower than it was earlier in the pandemic.
Test positivity and hospitalizations are also down.
Compared to where we were 4 years ago, I mean, gosh, we are doing a lot better.
Doctors stress things could always change. COVID-19 is still out there.
It hasn't gone away. And it's not going to. It's going to continue to mutate, to stay active.
Right now, the JN.1 variant is making up the majority of new cases, and people are still getting infected, but the severity of the infections has changed.
We still see the vast majority of hospitalized patients are still the older patients, greater than 65 plus.
Health officials say the vaccines have played a big role in changing the course of COVID-19.
The vaccine has helped, certainly. No question about it. And people have either gotten the vaccine or gotten COVID or gotten both. And so obviously their immune system has gotten better in terms of handling it.
The CDC even just came out with a new recommendation for a spring booster shot.
But only in those individuals 65 and older or those who are immune compromised.
And doctors believe the vaccines will continue to be an important part of keeping cases low moving forward.
But for those who are older or who have underlying health conditions or are immunocompromised, they're at risk for pretty significant complications from COVID if they aren't vaccinated.
And doctors want to remind you, if you think you could have the virus, to test more than once, and if you test positive, to stay home. I'm live in Tampa this morning. Larissa Scott, ABC Action News.